Okay, deep breath. I know it says pharmacology up there, and it can feel like you're learning a second language. But here's the truth. The NCLEX isn't going to ask you about every drug ever invented that's on the market today. It's going to ask you about the ones you better not mess up. So today, we're going to master the top 25 meds that will show up again and again and again and again, because safe med administration isn't optional. It's your license on the line. Are you ready? Let's go. So what are the 5 big drug categories that you must know? Well, cardiac meds, antibiotics, psych meds, diabetes or endocrine class medications, and then pain medications and its antidotes. So let's break them down. There's side effects, nursing tips, and a little fun to keep your brain awake. All right, let's start with our cardiac meds. Let's keep that heart in check. So beta blockers, metoprolol and atenolol. Decreases the heart rate, decreases the blood pressure. But what are our side effects? Bradycardia, hypotension, and fatigue. So we hold it for a heart rate less than 60. Here's a little thing to remember. There's a lull at the end of metoprolol or atenolol. Technically, any beta blocker. So LOL equals beta blocker. So ACE inhibitors, lisinopril and enalapril. What are our side effects? Well, we got angioedema, we got a cough, and we got hyperkalemia. So let's avoid those potassium supplements when we're dealing with those new ACE inhibitors. Calcium channel blockers, amlodipine and diltiazem. Vasodilation, and that lowers the blood pressure. But what are our side effects? Well, peripheral edema and headaches. Now, digoxin. So digoxin can cause toxicity, but what are our signs? Vision changes, halos, nausea, bradycardia. Bradycardia. So if our heart rate is less than 60, we hold the digoxin. But what's our antidote if we have a toxicity risk? How do we reverse it? Digibind. Next up, antibiotics. Kill the bugs, save the patient. Let's start with vancomycin. Nephrotoxicity and ototoxicity. Well, if we have a toxicity risk, we need to monitor our trough levels. Next up, penicillins and cephalosporins. Well, with these, there's a cross-sensitivity. You have to check your patient's allergy history. Tetracycline, like doxycycline. Well, side effects, photosensitivity, and teeth staining. Not for kids or pregnant women. I'm going to repeat that. Tetracycline's doxycycline, not for kids or pregnant women. Now we get into aminoglycosides like gentamicin. Toxic to the kidneys and the ears. Acute kidney injury, chronic kidney injury, gentamicin can be problematic. So you need to monitor your BUN, your creatinine, and your patient's hearing. Let's get into our psych meds. We got to protect the brain and the mood. So SSRIs, sertraline or fluoxetine. So side effects are sexual dysfunction and insomnia. But the risk is serotonin syndrome when you are withdrawing from your SSRI medication. Lithium. Now there's a therapeutic range when dealing with lithium, 0.6 to 1.2 MEq per liters. Well, if there's a range, there can be a toxicity. What does that look like? Tremors, confusion, and GI distress. Now you need to monitor your sodium and your hydration when a patient's on lithium. Now we get into benzodiazepines. Well, what are our side effects? Well, respiratory depression and sedation. But the antidote is flumazenil. Now, endocrine and diabetes. How do we balance the hormones in our life? Well, let's start with insulin. Well, there's rapid acting. Onsets within 15 minutes, you give it with food. And then there's long acting. No peak, no mix. Now you can use metformin. But what's our risk? Lactic acidosis risk. We hold before contrast dye. So if someone is getting a dye for a scan, we hold that metformin. Now levothyroxine, we give it in the AM on an empty stomach. And signs that it's working is increase in energy and a decrease in weight. Now corticosteroids, what do? They're an immunosuppression and they cause hyperglycemia. But you have to taper them. Don't just stop them abruptly. There's a high risk for your patient if you were to do that. So now we get into the pain meds and the antidotes. Morphine. We have to monitor respirations. Hold if the respiratory rate is less than 12. An antidote, naloxone. Acetaminophen. The max dose per 24 hours is 4 grams. What's our antidote? N-acetylcysteine. NSAIDs, ibuprofen, naproxen. What's our risk? GI bleed and nephrotoxicity. We avoid these in PUD and kidney disease. All right, we've done our 5 categories. Here's some high-yield randoms. Warfarin, what's the INR range? 2 to 3. Antidote, vitamin K. And also, avoid the leafy greens. Heparin, APTT monitoring. And our antidote is protamine sulfate. Furosemide, what's our risk? It can cause hypokalemia. Monitor K, blood pressure, and daily weights. Potassium chloride, never IV push. Always dilute and monitor the site when giving potassium chloride. Albuterol, it's a rescue inhaler. But what are our side effects? Tachycardia and tremors. Inhaled steroids, like fluticasone, use after albuterol and rinse the mouth. Inhaled corticosteroids, IS, rinse the mouth. Nitroglycerin, max doses of 3, 5 minutes apart. Store in a dark bottle and can cause headache or hypotension. So let's try out an NCLEX-style question. A nurse is preparing to administer digoxin. The client's heart rate is 54 and they report nausea. What is the best action? Administer and document findings. Give the dose with food. Hold the dose and notify the provider. Encourage oral fluids. Take a moment and write down your answer. In this case, the answer is C. Hold and call. Low heart rate and nausea, digoxin toxicity. Don't risk it. Here's a nursing gold nugget to remember. You don't need to know every drug. You need to know the ones that hurt people when you get them wrong. Congratulations. You've just powered through the pharmacology jungle. Now, go review these top meds again and again and again until you could recognize digoxin toxicity in your sleep. Next up, we're diving into mental health and therapeutic communication, where how you say something matters just as much as what you are saying. Go do some practice questions for me. I'll see you back here in the next video.